Our second session. We're having every other month a fireside chat with outstanding experts in research and in the field, looking at the All of Us research program of the National Institutes of Health. And I want to thank all of our staff and also all of our consultants who are part of the All of Us program. We have a website, NHMAMD.org, where this recording will be housed. Next slide, Ben. And I do want to thank Ben Milano, especially on our staff, for really taking time to plan and coordinate this activity with everyone. And I want to thank all of the speakers too, and I'll introduce them in a minute. But let me just say, there's just a few housekeeping issues. We do have questions and answers after, I'm just going to give a brief presentation about the topic of enrolling participants in this All of Us research program and how to do that. And then we're going to have questions and answers from a panel of experts. And we're very excited to have them here with us today because they're all in their own way working with enrollment, especially of our Latino patients, into research programs like the All of Us. And because we are looking at COVID-19 this year, we thought we'd put a plug in for the need for enrollment in the current clinical trials. And there are two websites to go to. We encourage all of our providers and everybody else on the call to think about enrolling so that we can have new knowledge for the future. And to have a safe and effective vaccine, we do need 30,000 people at least for each clinical trial. The first one is coronaviruspreventionnetwork.org, and that is the National Institutes of Health clinical trial being done with Moderna. And the other one is covidvaccinestudy1.com, and that is the clinical trial being done by Pfizer. And today we're excited to announce that Johnson & Johnson announced that they are starting their clinical trial for a third vaccine in the what is called phase 3, where they have to enroll many, many thousands of people. So we're hopeful for some vaccine sooner than later. We don't know when, but hopefully by the end of the year. Next slide. So the All of Us research program is here. This is Dr. Collins, the NIH director, and the All of Us research program is a historic longitudinal effort to gather data from 1 million or more people living in the United States. You have to be 18 years old or older to create a diverse health database that represents us all. And by taking into account individual differences in life circumstances, socioeconomic environment, and biology, researchers can uncover paths toward delivering precision medicine or individualized prevention, treatment, and care for all of us. So that's what this is all about. Next slide. I just have a few slides here. So the value to participants. You know, when you talk to people about participating in the All of Us program, they are contributing to make it possible for your community to be represented in medical research. In this case, the Hispanic community. We need more Hispanics, Latinos from all different regions of the country. We're a heterogeneous population and we need people from different parts of the United States, different countries of origin to be a part of this. Your data can be used in studies that will lead to new understanding and new treatments. There will be a chance to learn about your own health, including personalized risk factors and exposures, and there will be a chance to learn about additional research opportunities that may interest you. Next slide. So why participate? Well, minorities make up 38% of the United States population. And they are going to rise to over 50%, 57% of overall population just in the next 20 years. And when we have clinical trials, which are research activities that include people, minority enrollment has only been historically less than 10%. So we're actively encouraging people to get involved in the All of Us research program. I'll just jump to the Hispanic population here. 18% of the US population, 3% of Hispanics are in the NIH clinical trials, and only 2.5% in FDA novel drug trials. Next slide. So that's why we need more of you to be a part of this. We have, let's see, Bert, you're, oh, I see.
Yeah, I'm sorry, I just got out of the hospital, sorry.
That's okay, that's okay. Now, historically, we have had in minority communities research being done where we have had historical abuses. And the government has apologized for some of this. You know, we know that marginalized people in our society through the ages, starting with the Native Americans, you know, when the settlers came from the old world to the new world, they practically wiped out all our ancestors that are Native American. And, you know, we know that there's feelings and distrust in our communities. But what we want to explain now is that if we're not a part of the research programs, we're not going to have knowledge about how to improve health for our own communities. And I have to say that we have NIH has lots of Latino and African American, Native American researchers now, and they're very cognizant of this. Next slide. So on the positive side, the enrollment now has 356,000 participants, and maybe more. We'll hear about that from our speakers. I think that what's important is that if 1 million people is the goal, you know, we're more than a third of the way there. And I think 80% of the current participants self-identify as belonging to one of our underrepresented groups that we just showed in research. So that's fantastic. NIH, with all of its partners, is doing a great job. But we want to get to that 1 million, and we want to get to the 18% of Hispanic enrollment. Next slide. So one of the most important things that people ask is privacy of our data. This is an individual enrollment that we're talking about, and individuals need to have their privacy and security. And I'm not going to read all of this, but I think you should see all of the different steps that NIH has taken, from a data warehouse with advanced security to the researchers that have to agree to a code of conduct before accessing any of the data, and the certificates of confidentiality that have to be signed. And there's going to be transparency. And I have to say that none of this data is going to go to any other federal agency. This is just a research program of NIH. Next slide. Next slide. So the All of Us research program has initiated some more scientific activities to better understand COVID-19, given that COVID-19 happened to fall right in the lap of a research program that was ongoing across the country. So we've been able to see NIH use the All of Us research for antibody testing that may result in some new therapeutics, COVID-19 participant experience survey, and an electronic health record integration. You know, given now that there's so many more doctors using telemedicine, it's going to be very important to be able to share data through the electronic record integration that NIH is doing. And next slide. And there's also genetic results. You will now, if you apply and enroll, this is another big plus. This will be a free information returned to you on genetic information, your ancestry, your traits, whether you may have an increased risk of developing a particular health condition, how your body might react to certain medications, and other health-related information. Next slide. So all of this is about how to enroll. And one of the biggest, next slide, one of the biggest issues here for us, one of the biggest exciting, I'll say innovative attempts at a clinical trial is to have so many people all over the country, so many institutions. I know it's hard to read, but these are all of the networks called the All of Us Consortium that are involved with enrollment. And you can see, if you can, the different states of the country, different regions of the country. These are enrollment sites. And there are also networks here collecting the data. And next slide, which I think is the last slide, is that these are our community partners and provider partners. National Hispanic Medical Association is here, as are some of our organizations on the phone. I think all of the organizations on the phone, I'm sorry. I see APHA, the Alliance, and everyone that is a part of this is excited to be able to have more people from our communities enrolled. Next slide. And and I'm not going to tell you how to enroll because you'll have to go to this website and we'll have more explanations from our speakers. If you go to the very first website, joinallofus.org, you will have information there on how to enroll. And it's a very simple process. We'll hear more from our speakers about that. So now it gives me great pleasure to introduce our 4 speakers. And I am going to ask them questions and they will be providing their answers. And let me remind everyone on the phone, on the Zoom, that if you would like to ask a question, please do so by typing it in the chat box. And after we ask a few questions, we will look at the questions in the chat box. So our first presenter is, not presenter, but speaker, Jose Ramon Fernandez Peña. He's the president-elect of the American Public Health Association and currently the Director of Health Professions Advising at the Northwestern University. Bert Johansson is the treasurer for the National Hispanic Medical Association Board of Directors, and he is in a clinic in El Paso. I know it's Clínica El Fe. Edgar Gil Rico is the Senior Director for Innovation and Programs at Program Development at the National Alliance for Hispanic Health here in Washington, D.C. And Heather Kitzman is the Director of Research at the Baylor Scott and White Health and Wellness Center in Texas. So let me go ahead and, let's see, I don't think I have to do anything with the slides, the presentation here. Let me go ahead and ask the first question. Edgar, this is about people that are currently enrolled. Could you give us some more update on who's enrolled? How many people are enrolled? How many are Latino, Hispanic?
Thank you, Dr. Rios. It's a pleasure to be here. Great question. And you mentioned in your slides, you say 356,000, 358,000 people have enrolled. I think that what is important to emphasize is this program launch, it opens to the public 2 years ago. So imagine that in the first 2 years of the program, as you say, we already have a quarter, right? Mm-hmm. And imagine that of those, we currently have 17%, 17.5% of the participants enrolled describe themselves as Hispanic or Latino. So it's a great number. I think that's probably one of the largest studies already and the largest number of Hispanics that we have in the study. And it shows the efforts of the program to try to make it as diverse as the United States is. We're a very diverse country, and I think that the program has put a lot of emphasis bringing all of these partners together to really represent all of our communities. So we're happy. It's a lot of hard work, and I know we're going to be discussing that when you talk to the Hispanic community about participating in research, and that's part of why we're here today. So I think that we're in a good stand right now.
Could you just tell us a little about what you do at the Alliance in terms of enrolling people? You get a lot of different types of questions.
Yes, we do. So as a national organization, we're one of the national community engagement partners. So NIH approached different partners of Asian Americans, African Americans, Hispanic Americans, and told us like, okay, how can we talk to our communities about this? So I think that that's one of the first good steps that NIH did this time, is involve us from the start. If we want to reach our communities, we have to go through the channels that they trust, right? So in my work, we do work with community-based organizations. We have community health workers, promotoras working and talking to the community on the basics of really what you were saying, like, are people now with COVID-19 more interested in participating in medical research? Well, our conversations go way before that. Like, how do medicine affect you? Do you know how medicines get produced, and why you should know about more about your own health? And why is it important the health of your family? Like, that history behind you is really something that will help us understand better how to treat you in the future. So the work that we do is through base organizations, the folks that are on the ground, frontline staff, which is the ones who really have the ear of the community.
Yeah, thank you. And I know your organization has been around a long time, working directly with consumers in our community. So thank you for that. Heather, to talk about some other realities of enrolling Latinos, how do we work with those Latino individuals who are afraid of participating for several reasons in a federal funded research program?
Yes, that is definitely a concern that we hear. And especially for Hispanics, there's concerns regarding someone's status in the United States, but there's also history of mistreatment of minorities in past research. So we try to acknowledge and address the fact that people may be very concerned about providing information to the federal government or being part of a research study. However, it's our job to make sure that everyone, including the Hispanic community, feels comfortable engaging with us and enrolling in the All of Us study, and with the broader medical community. And there's lots of things that we do to try to make that better, like the use of promotoras and community health workers to talk to people about why it's important for their data to be included in this study. We want Hispanic individuals to know that anyone living in the United States can participate in the program regardless of their citizenship status, and that All of Us, as you saw on that previous slide, works very hard to keep data private, including from other government agencies. That's what that certificate of confidentiality is for. So All of Us is working to understand the needs and the concerns of the Hispanic community, and is committed to making it possible for everyone to be a part of the study, which I think we're seeing in our numbers already, with that 80% being from typically underserved or from folks that don't participate in research on a regular basis.
Okay, great. And I know you have a lot of experience with enrollment because you're one of the partners also, right? What is the title of your group, of the institution?
Well, we're one of the HPOs, so we're one of the health partner organizations, and I'm at a health and wellness center in South Dallas, which is a large Hispanic and African American community of Dallas. But we have several federally funded trials, but we're a network of primary care clinics that provide care to the uninsured. Texas has the highest uninsured rate. So it's a nice combination of primary care along with opportunities here in the neighborhood for people to participate in federally funded research.
Okay, great. So let me drop down to Jose Ramon Fernandez Pena. Why is the All of Us research program important from a public health perspective? And I know you're about to become the leader of the biggest public health association in the United States.
So help me God, right? I think that from a public health perspective, you touched on it a moment ago, Dr. Rios, the current pandemic we are experiencing, the COVID-19, and the need to ensure that our community is represented in those clinical trials to ensure that we are benefiting from the science as it's coming out. That is but one example. We can sing the praises of precision medicine, not only from the clinical side, the treatment side, but also from the prevention side.
Okay, and from the American Public Health Association, have you had much discussions about the importance of the All of Us to the next generation of researchers?
We have indeed, and we've been supporting this effort for the past couple of years. through not only the mothership, but through the affiliates that compose a larger public health community in the United States. So we're trying to make sure that all our 54 affiliates around the country are aware of the benefits of this program and are helping in recruiting individuals into the 53 affiliates I just remembered, are participants, active participants in recruiting individuals, providers as well as within the communities, to ensure that they know about this program, they know about the importance of participating, like Heather was mentioning a moment ago, trying to clarify the concerns that they may have about participation, and just with a larger goal of making sure we are represented in these trials, in this and many other trials.
Okay, great. Now, Bert, I hope you can answer a question and drive, or do you want to pull over? Let me.
I'm okay. I'm on the border, so if you lose me, I want to apologize for driving, but I'm covering both inpatient and outpatient right now. So
Okay.
I've never done this before in my career, but as I'm spending time, I can deal with it.
That's okay. That's okay. But
If
Bert,
you
let me just.
encourage Spanish.
You're a researcher, and you've been a researcher for Latinos for quite a while. Can you just tell us from your experience, how do you talk to Latino patients to convince them to enroll in a clinical trial or in a research project? What kinds of discussion topics come up? But how do you think you've made a positive impression?
That's a great question, and thank you for asking it, because I've had experience with the Latino community in New York with Puerto Ricanos and Dominicans, and now that I'm working down here on the border, Mexican American, which is really a complicated ethnic group. And the first off, you tell them the truth, and you recognize that there are real and perceived injustices toward our community. Recently, I had the opportunity to take care of a young man from Guatemala. He was Cuenca, and I made the mistake of speaking to him in Spanish. Why was that a mistake? People my color who speak Spanish in Guatemala have been trying to kill him for generations. I bring it up because I was able to convince him to get into an experimental treatment for his leukemia by sitting down and talking to him, gaining his trust. I talked to his mother in Guatemala. I found a Guenque speaker. And finally, he looked over to me and told me, "Claro, I trust you." We were able to get him to Sloan Kettering to get him on a treatment. So it's centered around telling the truth, recognizing where he was coming from ethnically. He's a subgroup within in the Latinos, and that he had been suffering prejudice. And I told him, this is America, and I gave him my word. So the eye to eye and the contact, recognizing cultural appropriateness is how you do it. And it takes time.
Okay, let me ask you this. Doctors are now using, computers, telemedicine. What's the discussion there? And I'm not being facetious. It's still eye to eye, but are you having any difficulty with that?
I've refused to use telemedicine. My patients are very sick, and I work in an ICU. My patients owe me being there face to face, so I'm there. And I know, and you're absolutely right. Part of our culture is face to face, making that contact, and I'm glad you brought that up. It's important.
Okay, well, just thought I'd throw that in. Let me go back to back to Edgar. Edgar, we have another question here for you. How is the All of Us research program reaching potential Hispanic patients across the country? What are they really doing in terms of building trust? And the All of Us research program has a lot of different partners. Is your hand on the pulse of what you think is really working? What are some best practices that you learned about?
Thank you, Elena. And this is actually a perfect segue to Dr. Johansson's answer, because he gave already the bottom line. Is the face-to-face, one-on-one contact, the trust of the community. So, but we in the Hispanic community, we are multi-generational, we are multilingual, and something that the program has done that I really think that from the start was really open to the community of doing this is probably. It's one of the only programs that you have that is fully bilingual. You can enroll in English or Spanish throughout the entire process. They have have a multi-pronged strategy. So we do have national partnerships. So Unidos USA, LULAC, the Association of Physician Assistants, the National Association of Nurses, all Hispanic organizations that have interest in the community are part of this, right? So you have that national connection. But then also you start going down gradually and you start seeing federally qualified health centers and La Clinica and the place where the community is going, where they meet Dr. Johansson and where they say like, I have this issue, can I trust you? Can I talk to you? And being that transparent in the program and having all of this team of organizations who are just really educating, because for us, our goal really is how do we get to the community all the information that they need about research and participation in research so they can make an informed decision. They know that they can withdraw. They know that they can share as much or as little information as they want. These are all steps, and as Dr. Johansson was mentioning, it just takes time. It takes time to get people to understand how big of an endeavor this is, how much we could do with it, but also how much information you need to be able to understand what your participation means. And another participation of you are a subject of research. That's what the program changes. That's where the program comes strong and say, you are a partner in the program, you own your data, you can see your data, you can see what studies are happening. So it's a lot of information that I think that when the community sees the entire picture, it's not only the philanthropic that we're saying like, hey, for the future of your health, for your family, for your kids and your grandkids. It's really understanding that it goes beyond that. It goes beyond your family, it goes beyond your community. So that work that we do in a one-on-one, which COVID-19 has really hindered our agencies to be able to do that. It's that
Right.
communication.
Okay, thank you. Heather, another question for you.
Sure.
So how do we actually enroll the patients? You know,
Yes.
why don't you tell us the step-by-step and how easy it is?
It is easy.
Okay, so why don't you let us know how we
So,
can do that?
okay, so when somebody wants to enroll, they get on the website that you mentioned earlier, and they can start that process on the website. Then once they get into the system, so they do their consent form and they answer some questions about their health and their lifestyle, the database will connect them to the closest enrollment center. And that's where they can go in and give a blood sample or a saliva sample. And that's what allows all of us to process their genomics. And that genomics is critical for the personalized medicine or the precision medicine that all of us is trying to do. Now you can participate without providing that sample. So it's really up to how far you want to go. There's also a direct volunteer opportunity. So if there's not an enrollment center near you, all of us will send a saliva kit to your house, and then you send that saliva kit in. So there's more than one way to enroll. After you enroll, they'll reach out to you here and there with different surveys, and you don't have to complete them, but you can. And of course we want you to, but we also understand that people have time burdens. So really it's up to you how much you want to interact with the All of Us study moving forward. We of course want people to interact as much as they possibly can because it helps us understand the environmental contributions to their health, you know, their genomics to their health. And another piece that is really important is the release of your electronic health records. And that's really scary for people. The thought of letting folks access their electronic health records. And this goes back to the confidentiality that we talked about at the very beginning. All of this is de-identified and highly protected. So and if there is a data breach, all of us is committed to being transparent about that. But I've worked in research for a long time, and it is very robust how they're protecting folks' data. But that EHR data, your medical record data, is so important for the precision medicine innovations that we're trying to find. So if we don't know what chronic illness you have, and we can't match that with your genomics, then we can't make those recommendations for specific ethnic groups or individuals living in different parts of the country. So we of course want everyone to enroll fully, but you can enroll in whatever capacity you feel comfortable.
Okay, and again, can you remind everybody the age that you can enroll
over 18.
And are people that are, all kinds of people can apply. I'm going to say everybody in our families, no matter what your status is. I'll just
your
say
entire
that.
family can enroll in your whole house as long as you live in the United States. You can enroll in this study.
Okay.
So if you are an American citizen and live outside of the United States, from what I understand, you can't enroll. You have to have a United States address.
Answers my question.
Correct, right, Edgar?
Okay.
Yes.
You have to be living here or
To live in the United
here.
States. Mm-hmm.
Well, that makes sense. So let me switch gears here, and Jose Ramon, I'd like to ask you about the workforce issue. And what do you think, from your experience, do you think that the workforce, and we can have our patients enroll, or people can enroll at hospitals, at clinics, different provider sites, different community-based organizations. Do you think that people working there should look like Latinos? Do you think that will encourage the enrollment in our community?
I think so. I love hearing the answer of Dr. Johansson regarding his encounter with this individual from Guatemala and the application of the so-called Latino cultural values of familismo, personalismo, simpatía y respeto that are so important. So, and earlier on, Edgar talked about the fact that about 17% of the people enrolled in this program are in fact Latinos. That's absolutely wonderful. But we Latinos represent almost 19% of the population of the United States and only 5% of the physicians in the United States, 4% of the nurses, 5% of the dentists in the United States. We are dramatically underrepresented in the health workforce. Therefore, this is a very serious aspect. It's a lot easier to trust a person like Bert when you come into a consultation that can actually take the time or may understand the subtleties that a Latino is not one size Latino. We come in all sorts of colors, flavors, cultural backgrounds. Some speak Spanish, some speak English, some don't speak either one, and we're still Latinos. So when we can find comfort in a person, provider, recruiter, community health worker, anybody that is gonna see me as a person and is going to try to speak with me in a way I can understand, in a way I can relate, where I feel respected, where I feel I can trust this individual with this kind of information, it's paramount to the success of a program. So yes, I feel very strongly about the lack of diversity in the health workforce and its implications across the board, not only in medicine, in public health, in dentistry, in every part, in mental health. So yes, I think it's critical.
Yeah, and honestly, I think that all of our research programs, I think it's great that all of us is really putting attention on the need for diversity of our participants that we are trying to enroll. But I do think that it's important to start thinking about how we build the research workforce. And maybe this is something that we can take back to all of us, what you're talking about, Dr. Fernandez Peña, the importance of that so many years have gone by since affirmative action and financial aid and commitment from the federal government to help our institutions turn their mission statements to have diversity and to even think about having a diverse student bodies in colleges and research institutions, whether it's public health or medicine or nursing or dental research. I think it's so important that we have to do more. And we really need to have stronger mentoring. As we're seeing the first generations that are the result of the help from the federal government to our institutions to have a diverse workforce is all retiring. And the next generation didn't happen. It didn't increase. We've pretty much stayed flatline. Yeah. And I don't know if anyone has any comments about what would you suggest? mean, Heather,
Well,
you're in
yeah,
Texas. I mean,
I mean,
what would you suggest?
my entire staff is Hispanic and African American, and I think that if you're doing health disparities research and working in minority populations, it's really your duty to ensure that you are representing those folks in your research staff, and that you're also training people from those communities to participate in research as a staff person or as a volunteer. But so that's the ethical thing to do, but it's also the most effective thing to do. So having folks that are culturally relevant and look like the people they're working with and can talk to them in their language, it makes the research so much better. And it makes people stay, they feel connected, they're retained, they participate more. So it's really a win-win. The right thing to do, but it's also the most effective thing to do.
Right. Okay, well, another question you mentioned about the opportunity to have an enrollment process sent to your home. Can you get a mailed package of information? Does
Yes.
it have to be just online? I mean, that's another thing to consider with the digital divide in our communities. I mean, can we?
Yeah, so
can we make a
that
phone
is one
call?
of, yeah,
Get a
that is one of the problems. It does have to be done online for the direct volunteer process. However, we do a lot of things in the community, and I think throughout the United States, they're doing this as well, where we'll go to a community site and set up computers and help people become direct volunteers right there with them. So we help them sign up, and then it's sent to their house, and they have the instructions on how to send it back. Because you're right, we do have a real issue, particularly here with our older folks with using the online systems or lack of internet or inconsistent internet. So that's why the community hubs become such a great place to enroll folks, either with an enrollment center nearby or really right then on site. We try to do a lot of mobile enrollment or helping them with that direct volunteer opportunity. The goal is to get as many people access at once.
You know, Dr. Fernandez Pena and Edgar, because your institutions are directed at schools and students, you know, and Edgar, I know you work with community, but you work with a lot of younger people that, I mean, 18 and over. Have you thought about, or have you done any kind of enrollment to research at the universities?
That's a fantastic question, Elena. Actually, with UTEP, University of Texas at El Paso right now, in the College of Science, they're one of our local partner sites. So yes, because we understand our communities are so diverse and the kids are probably at the university level in some cases, we have been training students who are in the STEM field at these colleges and universities to be ambassadors for the All of Us program. Because as you say, the digital divide, my mom only speaks Spanish, there is no computer, but if the kid comes home and say like, hey, I learned about this cool program today during my class, my science class, and we should all participate more because of A, B. So it's that multi-pronged strategy that I was telling you before. So we have fantastic ambassadors at UTEP. Like El Paso is a great city for us because we have the promotoras working on one side, then we have the students at UTEP working on the other side. And then we also work with a center like BNBVIR, which works with our elderly community in El Paso. So we are trying to get to the communities through all different generations and using the languages that we have. So that's one example. But when we talk to the kids, as you say, if they're at university level, we're not limiting to like be a participant of All of Us. We're starting to move into like research, join All of Us research. There is the database is available. There is information there if you're thinking about writing a dissertation or starting to look into what kind of career you want to look into it. It's a huge amount of data about your own community. You know, this is where we're connecting. Like we want our folks to be studying our data. And that's kind of like, how do we get more of these kids enticed and excited about like there is science behind it and there is science that can look at our generations and your grandparents and there's really cool things to learn from it. So at the end, you know, if they become participants or if they look at the data, I go both ways. The important thing will be to have more of these younger generation to go into research and look at all of these things that are happening. And you already have it. You already have people who have gone into medicine and become scientists because there was cancer in my family and I wanted to figure out what happened. And I don't want this to be replicated. So that's where we are reaching out to these communities and in different partnerships with institutions.
So Bert, just to pick up on that, don't you think this is a unique program because it's across the United States? 1 million people is the goal, and it's going to have a database that will be open access for the next generation of researchers. And the enrollee, how would you tell your patients that this is a real opportunity for our young researchers to build their careers and, you know, to explain to them how they can really help students. Like students get money to go to college, you know, they have to have loans and scholarships, but they also, if they want to go into research, as Edgar was saying, we need more Latinos to do research on our own communities. This is a win-win for the careers of the next generation of researchers. But how do you explain that to your, you know, your chronically diseased patients that don't understand or don't know about that?
Well, I try to approach young people. I was just very excited to hear about my colleague from UTEP. I'm going to be brutally honest. We don't have an academic medical center here in El Paso. Texas Tech does not fulfill our needs. We have very poor education in the high schools. So to answer your first question, is I try to get young people excited. You know, we were using Zika, and yet I have patients here who are delivering babies and who are Chagas positive. And I address the question, why was this neglected? And I point out, no Latinos were in here asking these questions about diseases that are unique to us. So I get them excited about those projects. Recently, I started a project looking at adverse childhood experience events, about living on the border, about threats of being deportation. And of course, we all have stories about La Rayona and La Migra. And I get kids excited about things that they can see going on, getting there. Now, as far as my colleagues, you know, again, we have a shortage of Latino doctors here in El Paso. You know, in fact, you know, the El Paso Medical Society, we don't make up the majority of doctors. It's people who are non-Latino. I try to get them excited about not just practicing medicine, but also answering questions that we see in our patients about why do certain drugs work in some patients? Why are we seeing here in El Paso, we don't have a higher rate of cancer, but we have a higher rate of some unusual cancers. Why? I'm finding kids with Tay-Sachs who are Latino. Why? Let's get interested in this. So I try to use enthusiasm and role modeling. And again, most of my colleagues are over at UTEP. And thank God for people like Eva Moya. So does that answer your question?
Sure. Yeah. Yeah, no, I mean, you know, we're just here. Again, I'm just going to give a plug for the All of Us research program from the National Institutes of Health. All of our panelists are from different institutions and organizations that are all partners with NIH, because we believe in having more enrollment of Latino participants in this research program. But let me ask, there is a question from our audience, and please, anybody have questions, please write them in the chat box. Given COVID-19 this year, there's a lot less people that are leaving their homes. We heard that you can go online and have the package delivered to your home. But how can doctors and nurses and those enrolling patients, how can they reach more people? How do you get to our communities to get them to go to the enrollment sites? Heather, do you want to talk about, you know, what's happening? Are you?
Yeah.
You mentioned that there are enrollment sites or there are mobile sites that are happening in different times, different places. How do you let our communities know? And you're in Texas. You know, we've got a lot of Latinos all over the country.
Yes. I mean, so right now, All of Us is close to in-person enrollment. That will change soon, I'm sure. So the way that we're keeping people engaged and informed and letting them know they can do that direct volunteer opportunity right now, or they can start the enrollment process and then give their sample once we are open to face-to-face again. we work with a lot of community partners like Edgar and his group to do Facebook Lives and give presentations on things that people are hopefully interested in. When we are face-to-face, we go out to tons of community events, health fairs, churches, schools, and give a presentation and then enroll people there on site if they're interested. So those are some of the strategies that we've been using. I think all of us has done a great job with community partners across the United States, helping us really get into the homes of their members to talk about this study.
Okay, great. And Edgar, you're in Washington, D.C. Is there any other strategies that you're using to enroll that we haven't talked about?
Well, Elena, from what we have, the agencies that work at the community-based level, what we hear from them and what they have been telling us, and this has been an agreement. First is the safety of your staff. First is the safety of the community. First is the current needs of the community. So if you are helping people to get their groceries, to pay their rent, to register for voting, to do all the other activities that are first and foremost in the head of each participant, right?
Yes.
It's take care of that. Take care of that, because part of why we have built the trust with the community is because we listen to the community's needs. There's going to be time for all of us. We keep talking about all of us. All of these agencies are multi-service agencies, so they have the computer there, and they probably provide the childcare for the kids, and the families will keep coming back, and they will keep hearing from us about the All of Us program. But first and foremost, just address the needs of the community at the moment. Let's take care of ourselves. Let's all keep trying to be as healthy as possible. And then all of us is there. And the good thing that we have been trying, and the program has been trying to do, is what you mentioned at the start. They are doing 3 activities for COVID-19. They are doing the antibody testing. They are sending this survey to current participants. So those are the ways that we have been telling the community to say, like, look, if you have the time, if you have fun, if you can create an account and answer the survey about how COVID is affecting you, that helps. Any information that you provide to the program is good, and it's good information for us to have. So those are kind of like the discussions that we have been having with the communities right now.
Okay, I think that's great. And so, you know, we're gonna go ahead and wrap up. I know we've been here almost an hour, and I'd like to just ask one question that, for closing remarks, if you given your leadership and your excitement about enrolling Latinos into the All of Us program, and given the importance of a public health, I think it's really imperative that we increase diversity in healthcare, in the workforce, and in research, and in our community-based groups, and in all of our healthcare facilities, whether they're nursing homes or hospitals, doctors' offices. We need more Latino front-end staff, and as well as the professionals everywhere. So if you had one last comment to say, and this is about the importance of diversifying our enrollment in research, what would you like to say? And let me start with Dr. Jose Ramon Fernandez Peña, the president-elect of the American Public Health Association.
It really is about advancing racial equity. If we're honest and mean to do that kind of work, this is as important as it is to diversify our health workforce. We are all committed to ensuring that people have access to services. We are all committed to ensuring that treatments are adequate, that people can afford them, and that we take into account all the perspectives that make a healthy individual, and that we work towards achieving it in an equitable manner. So it's inspiring to see that this program is going so well, that we are able to partake in this incredible adventure to collecting data and understanding better how we all respond to different treatments, medications, etc. So it's a very exciting time in a very dark time. So.
Yeah. Right. We're actually living through history.
Mm-hmm.
Yes. Dr. Heather Kitzman, the research director at Baylor Scott and White Health in Texas. What is your closing remarks here?
My closing remarks is that we have to walk the talk, or talk the walk, whichever it is, at every level, because for our healthcare systems to be affordable and effective, we have to have diversity through every aspect of that system, right? From not just the community health workers, not just our frontline staff, but all the way up to our researchers and our physicians. And I think that's how we can start to solve some of the disparities and the difficulty that minorities feel when they come to the healthcare system, where they don't feel connecting, and they don't have people that look like them. We have to invest across the entire spectrum of healthcare and research.
Okay, and Edgar Gil Rico from the National Hispanic Health Alliance, and a partner with all of us.
Well, I will.
Closing remark.
Well, I will first say thank you to all the public health professionals and all the frontline staff who has been keeping us healthy and ongoing during this pandemic. And I really want to give you guys a call and say, hey, you are the trusted vehicles in the community. You are the trusted faces. You understand the importance of giving voice to the community, and this is an opportunity for our community to have a voice in research and voice in health. So give us a hand, we're here and we're open to all. So support the program and keep supporting us, and thank you for all the work that you're doing out there.
Great, thank you. And our last comment from Dr. Bert Johansson of El Paso, Texas, and previously in New York, and on the border. And I know you're yeah, no, go ahead.
I'm sorry,
Bert.
what?
No, go ahead. Give us your comment.
Okay, well, I agree with everyone said, and again, I extend my thanks to all your colleagues. You've really filled me with a lot of hope, because down here, again, we don't have the academic institution, so things like All of Us give me an opportunity. I'm working with 4 MAs. They're graduates from Bowie High School right here on the border. It's a level 3 school. And as I talk to these 4 people, had they been wealthy or Anglo, they would all be doctors. They amaze me how much ganas they have, enthusiasm for wanting to do things. And they go and they read. All of us as Latinos and as role models need to recognize that and encourage them to apply to the National Hispanic Health Foundation for scholarships. Because a lot of things, Latinos, we don't want to borrow money. And when you turn around and say, hey, look, you should be a doctor, you should be a nurse, we need to do that. And earlier you mentioned to me about telemedicine, and I was being somewhat facetious, but I'm true. In order to gain the trust of my patients who are suffering from COVID, part of the reason I decided to go open this COVID clinic was we had Latinos dying at home. They were being found by their spouses or their families. I show up in front, and I make a point of eating and buying my horchata in Socorro Barrio. And that has earned the trust of my patients as well as the MAs who work with me. And we as Latinos, especially those of us privileged to be doctors, need to remember that we're being watched. And my grandparents did not cross that border and bring crime or disease. They brought hard workers, builders, right. And we need to remember that. Una raza, ¿verdad, señora?
Yes, of course. And let me thank all of our presenters again. We had a great 1-hour session here, Fireside Chat, about the All of Us research program. I'm Dr. Elena Rios, President and CEO of the National Hispanic Medical Association, and it really is an honor, and it gives us pride to be able to help educate the community out there who's interested in helping our community. And these are our upcoming sessions. Our next session will be December 10th, where we will be talking about research on seniors and the importance of learning more information about seniors. And then we'll be talking more about just research in general and the importance of research to our communities. And our last session will be on women's health. We hope to continue All of Us research program. I want to thank Ben Milano on our staff and Claire and all of the other staff from the All of Us team. And I want to thank all of our speakers. So with that, I wish you good night, and I hope everybody stays healthy and safe. And what can I say for the good public health doctor here? We have to wash our hands, wear our masks, and stay away from crowds.
Yes.
And not get COVID, and stay as safe as we can, because we need you at work, and we need you doing you know, all of the great work that you do for all of us. So thank you very much.
Thank you for having us.
Good night.
Thank you.
Good night.
Bye, Uncle Leos.
Bye.